Swadika and good afternoon, and welcome back to the English language summary of the press briefing live from the COVID-19 Situation Administration, or the CCSA. First of all, I'd like to thank Dr. Teasing for the summary of the CCSA meeting this morning that he just provided to us just now. And for today's briefing, which is Friday, the 30th of July, 2021, let me start with an update on the number of vaccines that we have administered since the start of our national vaccine drive. Yesterday, we administered 420,148 doses of vaccines, and that's increased our total number of vaccinations now to over 17 million doses, and that is a coverage of 20% of the total population for those who have received the first dose. Also, we have some good news to inform the public that the vaccine distribution plan now will be extended to people aged over 18 and those afflicted with any of the 7 underlying diseases who registered in advance. And this is starting on the 1st of August. But for foreign nationals residing in Thailand, also in the beginning of August, the Ministry of Foreign Affairs will be opening an online platform, a website, for foreign nationals to register for vaccination. And this will be open to all age groups. But of course, appointments, priority appointments will be given to those in risk groups first, namely those aged 60 and up. But I have more good news to announce today, because during this global health crisis, when help and compassion is much more needed, we continue to promote international cooperation to fight against the pandemic. And we therefore very much appreciate the kind assistance that we have received from friends worldwide. Yesterday, Thailand received 102 ventilators and 1.1 million antigen test kits donated by Switzerland. And you can see on the slide right now, we had representatives from the Ministry of Foreign Affairs and Ministry of Public Health receiving the donations from the Swiss ambassador at the airport. And also today, we welcomed the arrival of 1.54 million doses of Pfizer vaccine donated by the United States. And the Pfizer vaccines were handed over early this morning at Suvarnabhumi Airport. And these vaccines will be distributed to 6 target groups, as mentioned by Kun Natapanu last Monday. So you can see on the slide where we have representatives also from the Ministry of Public Health and also our Director General from American Affairs of the Ministry of Foreign Affairs receiving the donation. So these 6 target groups, of course, will be receiving the Pfizer vaccines, and we assure that these 6 target groups include the frontline medical personnel and adults over 60 years of age and those with the 7 underlying medical conditions. Thailand, again, is also very grateful that the United Kingdom will start delivering their donations of 9 million vaccines around the world, including the 415,000 doses that they will be donating to Thailand to help tackle the pandemic in our country. And you can see on the slide we have today of our Foreign Minister, Kun Don Pramat Vinay, receiving these donations from the United Kingdom, the ambassador of the United Kingdom to Thailand. And Thailand deeply appreciates all these goodwill donations that will help increase access to vaccines to all people living on Thai soil. And we thank all these friends of Thailand for their contributions during our time of need indeed. And of course, these vaccines will go to the most vulnerable groups to help save lives and reduce the risk of hospitalization. Now let me move along to talk about some updates about vaccination for foreign nationals living in Thailand. And I can assure you that vaccination for foreign nationals is progressing very well. And starting from the beginning of August, as I mentioned earlier, the Ministry of Foreign Affairs will open a registration platform or a website for foreign residents of all age groups to register for vaccines online, and the appointments will be prioritized for those in higher risk group first. But of course, you will all receive your vaccines. Foreign nationals of all age groups residing outside the high-risk areas of Bangkok, Samut Prakan, Samut Sakhon, Pathum Thani, Nonthaburi, and Nakhon Pathom. These provinces that I've mentioned are within the dark red zone or the maximum control zone, and therefore we need to accelerate vaccination for all people living in these areas, and therefore foreign nationals living in these provinces may also register for vaccination with hospitals where they have prior medical records right now at their earliest convenience. And you may look up the designated hospitals for vaccination services at the thailandintervac.com website. Although the thailandintervac.com website no longer receives registration, however, you may use this website to look up updated information about vaccination sites and also relevant, important information about vaccination for foreign nationals. So we encourage you to use this website and look up for where it would be most convenient for you to register for vaccination as soon as possible. Now, you'll see another slide. Also, this is just to mention for Chiang Mai, because we know that there is a large foreign population living in Chiang Mai. They have organized vaccination for registered foreign nationals in Chiang Mai at the McCormick Hospital, which is going to take place either this weekend or Monday at the latest. And it will start with foreign nationals aged 70 and up, and any vaccines left will be administered to those aged 60 and up. So in order to be vaccinated at these sites, you need to bring your passport or other official identification documents and bring your confirmation for your appointment for vaccination when you arrive at the site. So this is the updated good news I have on vaccinations for foreign nationals living in Thailand. Now, I'd like to move along and talk about the general situation and the statistics that we have reported today. We have new confirmed cases reported at 17,345 cases, of which 681 are inmates from penitentiaries. And therefore, today, our active cases and counting are at 192,526 cases, and these are patients currently being treated in hospital facilities. We have a good number of new recoveries today, standing at 10,678, which means 10,678 free beds for new incoming patients. We have today new fatalities reported at 117, and that brings us to a total number of fatalities since we have had the outbreak in Thailand, standing at 4,679. And this is a ratio of 0.81% fatality rate, and this is still well below the global rate. So the overall situation of the infection rate continues to rise across continents in many countries, including neighboring countries of Thailand. And particularly in Thailand, the COVID-19 cases have now been reported in all provinces, with an increasing number of cases found in Bangkok and its vicinity, as has always been happening for several months now. And the new clusters that we have found to date have been detected in the provinces of Samut Prakan, Chonburi, Pathum Thani, and Songkhla. And most of these clusters have emerged from manufacturing plants or factories, markets, and construction camps. So they continue to be the same risk areas as before. And therefore, the CCSA has decided that COVID-19 patients who have tested positive on antigen tests while in community isolation can immediately seek medical treatment under the healthcare system without first having the disease confirmed by RT-PCR tests. And this is so that we can help speed up the treatment of patients who are in community isolation and awaiting medical care. And the Public Health Ministry also plans to hold training sessions for communities to teach them how to conduct antigen testing with more accurate results. Now, let's take a look at Phuket and the Phuket Sandbox scheme and how it's been doing so far. So you see on the slide, this is the Phuket provincial order that was issued yesterday, which is the 29th of July. So Phuket announced the upgrading of travel screening measures for entering the province by land, sea, or air, starting from the 3rd until the 16th of August. And this measure will only apply to people arriving in Phuket from within the country, or only for those traveling domestically to Phuket. People arriving internationally via the Phuket Sandbox are not affected. Neither are those who are leaving Phuket. So let me repeat that this restriction is only valid for those who want to travel domestically from Thailand into Phuket only. It does not affect those who are traveling internationally into Phuket or those who wish to leave Phuket. Exceptions, however, for this travel restriction are for ambulances or transportation of medical supplies and other goods, and transportation to the airport, which of course you need to provide a same-day ticket as evidence, court appointments, and people on official business. And of course, these people need also to be vaccinated and have proof of a negative COVID-19 test that's issued within 72 hours prior to arrival in Phuket. So these are the exceptions who can enter Phuket. The domestic entry ban to Phuket via land, sea, and air only affects Thai and expat tourists as those who are looking to enter the island during a limited time that's only from the 3rd of August to the 16th of August. Additionally, the Phuket provincial order has closed some locations that have been deemed risky to further transmission of COVID-19, such as snooker and billiard bars, pool tables, game centers, and swimming pools. And this particular order will be implemented and effective from today until the 16th of August. So all these measures are proof that the public health authorities in Phuket province are closely monitoring the situation and will prevent any possible widespread outbreaks. And we hope that this will help contain any further risks. Also, before I leave, I'd like to announce, just as Dr. Tawisin just mentioned right now, that we will be rescheduling our briefings now to only 2 days a week for every Monday and every Thursday. However, this doesn't mean that we will reduce or limit the information that we will be providing to the public, because all updates and information will continue to be posted on the CCSA social media accounts and, of course, the Public Health Ministry website. And the Ministry of Public Health will also continue to have their daily press briefings on technical public health issues related to COVID-19 in Thai every day. And therefore, we will also summarize these briefings to our English audience at our briefings at the CCSA as well. So this is all I have for you today. Thank you very much for your kind attention. I hope you stay safe and have a very good weekend. And see you again on Monday with คุณณัฐพานุ ขอบคุณค่ะ สวัสดีค่ะ